Okay, so we were discussing about the investigation that after telling about the examination part, what you like to examine, you have to just tell the initial investigation, leave the specific investigation for the later on. And I would like to add one more thing. When it comes to a cancer diagnosis in a history-based scenario, there can be two possibilities. First one, when you ask the patient's ideas, he might raise a concern that is it a cancer? Then the approach is a bit easier and different to that. If the patient does not give you any idea, let's say patient says, no doctor, I don't know what's going on, then you cannot use the same approach we used previously. If the patient raises a concern that is it a cancer, ask the patient, may I know why do you think it's a cancer? The patient will tell his story, what's in his mind, and then you can tell him, by what you have told me, based on the examination findings and whatsoever the lab you have done, unfortunately it seems that it might be a cancer, because the patient has directly raised the concern of the cancer. So you can directly answer his question over here, that but don't be so sure that you are 100% confirmed that it is a cancer. Just say it might be a cancer, but at the moment I'm not sure about it. So what we would like to do is we will do some further tests and we will involve the senior. The other pathway or the other approach is, let's say you have asked the patient, have you got any idea why you are having this cough and blood? And the patient says, no doctor, I don't have any idea, please tell me. So now you have to tell the diagnosis to the patient yourself. So you cannot just say, based on what you have told me and your x-ray findings, it seems that it is a cancer. That would be a mistake. So what you need to do is, it's called a layering approach. Rather than going straight away to a diagnosis, tell the patient, from what you have told me and based on your x-ray finding, it seems that you have a problem in your lungs. Don't be specific. It can be many things. Considering a best case scenario, it can be an infection, but sometimes it can be something serious. And by serious, I mean sometimes it can be a mass. Mass can be sometimes tumors. Tumors might be cancers. So when you have to tell the diagnosis, don't straight away jump to the cancer. Use a layering approach. Tell him that it can be due to a variety of reasons. Considering the best case scenario, it can be just an infection, but sometimes it can be something serious. And when you are saying that it is something serious, give a pause. If a patient wants to raise a question, let him ask a question. Doctor, what do you mean by serious? Then you can say sometimes it can be a mass, and masses can be sometimes a cancer, and straight away you can say, but at the moment I'm not sure about it, I'm just suspecting it, and we will involve the senior. We will do some further tests to make sure that we are not missing them. Okay, so that's all about the feedback on this station. Okay, Dr. Ruj, can we move on?
Yes, sure. Thank you, Dr. Adnan, for a detailed feedback. And thank you, Dr. Monica, for coming up and performing the station in front of a lot of people. These are just small, short mistakes that if you take care of, you can, score high. Otherwise, you've done pretty good. Moving on to the next, Dr. Hina was ready to participate. Dr. Hina, are you still there?
Yeah, I'm here.
Okay, thank you. So once I show you the station, I'll begin the 90 seconds.
Sure.
Start.
Hina Ahmad, GMC number 1234567. Hello,
Hello, doctor.
I'm Dr. Ahmad, one of the doctor in the GP clinic. Can I have your name and age, please?
Yeah, doctor. My name is Kala, and I'm 62.
Okay, Carla, how are you?
Yeah, doctor. I'm here for the
Mm-hmm.
surgery. I think it is the time now.
Okay. So of course I'm here to help you in any way and address all your concerns. So can you please tell me in detail, like what surgery you are talking about?
Doctor, actually, I have this osteoarthritis of the right knee, and the
Uh,
doctor planned that I will have a knee replacement after 2 years. So I think now it is the time because I'm having so much pain in my knee and it's troubling my daily routine as well.
oh, I see. And I'm really sorry to hear that you're going through a lot for longer period of time. So before we discuss about the surgery, if it's okay for you, can I ask you some questions?
Yeah, sure.
So can you tell me, where exactly, in which knee pain you have the pain?
It's in the right knee.
Right knee, and since when you are having it?
It's been 5 years, but since last 6 months, it's troubling me more.
Oh, it must be really distressing for you to manage it, isn't it?
Yeah, doctor.
Mm-hmm. So anything have you tried that improves it by any chance?
Doctor, I'm taking the painkillers which are prescribed to me, but they are not helping that much now.
Oh, okay. And do you think that it is, as you told me that it is increasing day by day, what exactly type of pain it is? It is dull or
Doctor,
sharp?
yeah, it's a dull sort of pain.
Mm-hmm. Can you tell me the severity of your pain if you have to score from 0 to 10, 0 being mild and 10 being severe?
It's around 6.
Oh, okay. Beside that pen, do you have anything else?
No, I just have this pain all the time and more when I walk.
Okay, I'm really sorry to hear that. It's only in your right knee or any right knee or anywhere else as well.
Just in the right knee.
Mm-hmm. Can you tell me how's your mood at the moment?
Yeah, it's fine.
It's fine. Okay. Let me ask you a few more questions related to your general health. Have you been diagnosed with any medical condition at all?
No,
Are you on any medication, including over-the-counter supplementation?
just the painkillers for this.
I see. Okay. Can you just tell me, are you allergic to anything?
No,
Any family member have any medical condition related to the joints or otherwise?
no,
Okay. A few more questions related to your lifestyle. Do you smoke?
no, doctor.
Mm-hmm. And do you drink alcohol?
Uh, Only occasionally.
Okay, I see. And how about your diet?
Doctor, I generally eat almost everything most of the time. The fast food.
Okay. So you are kind of a fast food lover, isn't it?
Yeah.
Okay. So, have you know? Okay. Are you physically active?
No, doctor, because I told you that I'm having trouble with this pain, so I cannot
Yeah, of
walk.
course.
It's
Mm-hmm.
even disturbing my daily routine.
Oh, yeah, of course. Well, Carla, I would like to ask you a few more important questions, which I should have asked earlier as well. Have you noticed any change in your weight by any chance?
Yeah, I think that I'm gaining weight.
Mm-hmm. Is it intentional or unintentional?
Yeah, I'm just gaining it. Like, I don't want it.
Okay, I see. And can you tell me how about your appetite?
It's fine.
Okay, all right. And can you tell me this pain and everything, how much it is affecting you, your life and daily activities?
Yeah, doctor, as I told you that I cannot walk. I can barely walk to the washroom and I cannot go out of my house. So it's problematic for me.
Oh, I can see. It must be really upsetting you at times, isn't it?
Yeah, it is.
Really sorry to hear that. Well, thank you so much for answering all my questions at the moment. And at the moment, I would also like to do your examination. Is it okay for you, Carla?
Yeah, sure.
So I would like to do your blood pressure, temperature, heart rate, respiratory rate, doing your general physical examination, and doing your knee examination. Okay.
Okay, doctor.
Meanwhile, I would also like to perform your routine investigation that includes full blood count, liver function test, kidney function test, inflammatory markers. Okay.
Okay. Okay.
Okay.
So the examination and the vitals are normal. BMI is 37.
Okay. So I can see from my notes that as you also said that you have increased your weight in some time, which you really don't, but as it was unintentional, isn't it?
Yeah, doctor.
Mm-hmm. Actually, before me, have you talked regarding this to anyone regarding the surgery?
No, doctor. I'm talking to you. Please tell me,
Okay.
are we proceeding with the surgery?
Well, I totally understand that as it is affecting you, you badly want to go for the surgery, Carla. But at this moment, I can see that your weight is a bit on the higher level. Okay.
Mm-hmm.
So it is actually it usually does not come in the criteria to go for the surgery. Are you getting me what I want to say?
What do you mean, doctor? Are you not gonna do the surgery?
At the moment, I think that doing surgery for you is not a good. Before that, I would advise you if you can lose your weight.
Okay, doctor.
If you want and if you really have made your mind, I can also help you with that.
Yeah, sure. Please tell me.
So what I can do, I can refer you to the dietitian and also physiotherapist. What they
Okay.
can do, they can give you the diet plan properly, and physiotherapist will tell you certain exercises or which will not bear any pressure on your knee and otherwise help you in losing your weight. How does this sound to you, Carla?
Okay, doctor. That will be fine. Is there
Yeah.
anything you can do for me?
I would advise you that if you can cut down your dietary habits, like bring certain change in your lifestyle, like having healthy food at the home with the low calorie diet. Is it fine for you?
Yeah, I will try to.
Okay, that will be very good for you. And if at any time you feel that you need my help more regarding any reason, I will be more happy to answer you. Okay.
Okay, doctor.
Okay. Is there still time?
Time's up.
Thank you, doctor.
Thank you.
Alpha.
Yeah, pen management. Good.
Just 1 second, doctor. Okay. So thank you so much, Dr. Hina, for participating. I can not relate to how you were practicing or how you were even, doing the mock with the child with you. So this is really, really appreciable. And thank you so much for coming up and still managing to do the mock. So I'll be mostly whatever you've done. If you ask me overall, you have done a great job. Just a few things here and there so that it can help you uh, on the day of the exam, or you can learn from this. So to begin with, you started with the introduction. Your introduction was completely fine. You identified the patient, you introduced yourself. You started with the open-ended question by asking the patient why the patient was here, which is also correct. Your IPS from the beginning till the end involving the patient was good. The one small thing that happened is when you asked the patient why the patient was here, she told you, I'm here because I had this arthritis in the right knee and the whole story. You still, later on, you still asked her which knee it was. So it's just that the examiner might mark you down on listening because she already mentioned the right knee there and then. Then you asked a few questions regarding the knee. See, the diagnosis has already been given to you by the patient itself. So if you listen to the patient already told you that I had the pain in the right knee 2 years ago, I was told about the surgery, this was arthritis, I am taking painkillers. So the whole information was being given. You do not have to ask more history related questions because that will consume time. So you asked about, which knee, if it's there anywhere else, and what kind of a pain it is, and the severity, all these. A few questions, yes, they were important asking about the severity, but the rest could be avoided because you're not going to make the diagnosis here. You then asked about there and then, because the patient kept telling you, I am, it's bothering me, I'm not able to move around. You asked about the mood. It is correct. You do not have to always wait after the lifestyle or before the lifestyle to ask the mood. But at the same time, later on, then you again went to it, how is it affecting your life? So since the patient already told you that I'm not able to move around, you can ask her again if it's affecting her life or her work in any way, and at the same time ask about the mood. So you cover all these three questions together. It will just show an organized approach. Because it seemed like you came to this, then you went back to the other questions again. There's no harm, but still the examiner might mark you down on this, so it's better to have a proper approach in mind. Okay, after that, you asked about the past medical allergy, the family history, that was all fine. You asked about the lifestyle questions, and then again, you went back to the weight gain. Now, I'm going according to how you did it, so it will be easier for us to understand. When you asked about the weight gain and appetite, this is something you realized later, but yes, this was supposed to be asked in the beginning. Now, the BMI is 37. From the question itself, we come to know that this is going to be obesity counseling, right? So there itself, you have to ask 2 to 3 questions to show the examiner you do have other differentials in mind. Now, you need to ask her about why she's been gaining weight. You can ask her about some hypothyroid questions, just one or two, and if possible, depending on the age of the patient. If it's a young patient, it's not definitely the scenario, but if it's a young patient, you can ask about any, acne problem, any menstruation problem, but otherwise you can ask about familial obesity, just so that the examiner knows you do have other differentials in mind as well. So weight gain was a question, weight gain, and these 2 or 3 DDs, one or two, let's say, should have been asked there instead of the whole knee related questions. Okay, so then you came back to the lifestyle. You asked about all the lifestyle questions, which was completely fine. When she told you about the diet, you did comment there that was kind of that added to the IPS that you are a fast food lover. That was completely fine. Then the physical activity. Now here, the patient twice already told you that I cannot even move around because of the knee pain. So it is always advisable to ask the patient or first signpost the patient. I understand that you told me moving around has been a little difficult for you for the last 6 months, but do you manage to take or to have any physical activity at all? So the patient knows that you listened to the patient, and then at the same time, you can continue with your question. Or you can also, the other way around, you can say that I understand exercising might have been difficult since you're not able to move around. Is that correct? Yes. So this way you cover up the physical activity part, and the examiner will not mark you down on listening because it will seem like she told you twice and you did not listen to her. Okay. These are just small bits and bits here and there. Overall, you've done a great job, as I already told you. All right. Then you moved on to the vitals. Yes, you moved on that to correctly. You did the examination. You can say that in the investigations before that, if you've already taken your ideal height to your weight, because you have the BMI already, and then you can verbalize the rest of the examinations, rest of the investigations. Sorry. Now that your BMI was given 37, this is a positive finding. All the examination was normal. You have to tell this to the patient that I have checked you, I have examined, you have taken your investigations, everything is normal except for your BMI, which is 37. Do you know what BMI is? And then explain that to the patient. Well, you did mention about her weight being on the higher side, but still, if you have a finding, it's better to explain that to the patient. Now, till here, why I told you that your questions of history taking was a bit extra, let's say, because you started your counseling at 6 minutes. Since we know that counseling, this is a counseling station, you should keep your history very short so that you can directly jump onto the counseling. So, yeah. Then the patient asked you, doctor, when you may mention about the weight, the patient asked you, doctor, are we going to still proceed with the surgery, right? So one thing that you have to make it clear that you are in the GP, so the main thing that you will be doing is making a referral. Secondly, you said that it is not good to have a surgery now. It's better to explain to the patient what you mean. So you can tell the patient that, as I told you, that your BMI is this. The new hospital protocol says that surgery can be done at a BMI of less than 35, which means that unfortunately, even if I refer you now, they will not be proceeding on with the surgery until you fit the criteria. Are you getting me? Yes, doctor, I'm getting you. And then you can tell her that for that, mainly what we need to do is we need to concentrate on weight loss. I will be giving you different ways and different leaflets that will have different methods. However, the first and the priority is the pain management, because if the patient is not able to move around, the patient will not be able to carry out any of the activities or exercises that we tell her. So yes, you start with the pain management. You tell her that I'll be talking to my senior. You've already tried taking paracetamol. It is not helping. So we will be starting you on a stronger painkiller. Meanwhile, we have three different ways of losing weight. It could be with the lifestyle, with the medication, and with the surgery. Which one do you want to hear first? Ask the patient, because maybe as the patient, the simulator, they are given certain scripts. So maybe they have something in the script they want you to tell them about. But if you don't give them an option, it means you have never addressed their concern or you never answered what they want. Anyways, because the time was running short, so you took it as a general approach. So that you mentioned about the dietitian, you involved the patient very well with it, asking after everything, and you told them you even told them that you're available there for help all the time. So you have done a pretty good job, and just with the time management, I'm sure that you could have gone a bit further with this. Dr. Adnan, would you like to add something to this?
Yeah, I would like to just add a few more things. The
Sure.
first one, that when you asked about the severity of the pain, you use a scale from 0 to 10. So we can say it sometimes mistakenly. 0 means no pain at all. So when you are telling a scale to the patient, it's 1 to 10, 1 being the slightest pain and 10 being the worst pain. Don't start the scale from the 0, because 0 means no pain at all and the patient has the pain. So it's from 1 to 10. First thing. And the second thing, Dr. Aruz has told everything in the detail. Uh, Speaking as a patient, you were telling me about the lifestyle modifications. So it's always better, as the Dr. Aruz told, that when you have different treatment options or different management options, at the very beginning of the management, tell the patient all the options and ask him, what would you like me to speak first? Okay, because this is how you will tell the examiner that, okay, you know all about the management plan of the obesity, like what are the lifestyle modification, what are the medical treatment options and the surgical options, but you are prioritizing the patient's concerns. And even if you cannot complete within the time, the examiner will still know, okay, if you would have more time, you would have talked more about the surgery. And when I ask you, like, is there anything you can do for me, doctor? By that I mean, okay, now start speaking about the medication. Would you like to give me oily stat or not? Okay, so pay attention to what the patient are telling you. Sometimes they might give you a hint. For example, if you're going into too much detail of lifestyle modification, the patient might bring you to the next point. Okay, enough with it, doctor. So now let me give you a hint. So that hint can be in the form of question, like the way I asked you, like, is there anything you can do for me? Because by asking that question, I wanted you to talk about the medical treatment options. Okay. The rest of the things Dr. Rules has already explained. And one more thing, I really appreciate you that in the middle of the station, I noticed that there was a sound of a baby. I thought it might be someone other's mic which is unmute, but then I noticed no, it's yours. Uh, so I really appreciate you that you were doing a mock, and I think you were a bit distracted because of the baby, but still you had done an excellent job. That's really appreciable.
Thank you, Dr. Aruj and Adnan. And I'm glad that I performed and I learned as well. Thank you so much.
You're welcome.
Now, just one or two questions from the chat box. One of the doctors has asked if the psychosocial part is important. Yes, the psychosocial part is important, seeing her age and seeing that she's already mentioned, I'm not able to cope. She did not say that directly, but yes, she's not able to cope. So we need to understand and go into detail. But because she's already running out of time, it was already 6 minutes, then going into further detail of such questions is not advisable. But if you have time, it is always important to ask how she's coping, and if she needs any help, what kind of help she needs. Ask her about her house condition. Maybe it's a 2 or 3 story. She uses the stairs up and down. That's causing her the knee problem. Or if she needs any help in daily activities at home. If there's any family members living around who can help her. So we need to ask all these questions as well. Yeah. So the other question is, do we need to discuss in detail about the medication and surgery for weight loss? Well, you will hardly have any time to ask to discuss about detail to discuss in detail about all the three options. So it is always advisable to ask the patient what the patient wants to hear about. So maybe in their script they already want to hear about the lifestyle. So you start with the lifestyle, and if you have time left, you talk about the other two options as well. But as Dr. Adnan already mentioned, the offering the three options is just for the examiner to know that you know about all three and you're ready to talk about any of these. If in case the patient tells you, doctor, anyone, the patient gives you an option, doctor, you can talk about anyone, then you start with the lifestyle or with whatever you feel you're comfortable with. But it is advisable to start with the lifestyle first. You're welcome. Do we have any other questions? Okay, so the next question, what if patient wants surgery? Well, in that case, you need to tell the patient that surgery is never the first line. We need to begin by using the other methods to reduce weight. And if that doesn't help, we can proceed on to the surgery, or we can follow with the patient again and see how this is going. However, you have to consult with your senior every time that happens. But still, at this point, because the patient has never tried losing weight, has never tried the medication, so surgery will not be the first line. We need to explain that to the patient as well. You're welcome. Does anyone have any other questions? We can wait for another few seconds so that you can type it. Well, the patient was saying I'm in a lot of pain. Wouldn't we be offering pain medication? It says that she asked the patient if the patient is comfortable. So you can proceed on with that. If in case she didn't, then you have to ask the patient if you're comfortable. Most of the times, 99% of the times, the patient will tell you I'm comfortable. You do not, usually it's not advisable to be offering painkillers. There used to be some stations before the COVID situation where unless you offer the painkillers, the patient wouldn't open up, like in case of meningitis or in case of headaches. But now that's not the case. So you do not have to, you can ask the patient if the patient is comfortable to answer a few questions. And if the patient says yes, yes, you can proceed. Most probably the patient will say yes. If in case there is any changes and the patient says, no, doctor, I'm not comfortable, then you offer the painkiller. After, you will say that I'll be informing my seniors, I will be ruling out the contraindications and allergies, and then I would like to give my patient some painkillers. But that's very, very, very rarely since the last 1 year this situation has been coming. And especially in the counseling stations, the patient will be pretty stable. Okay, we have 5 minutes left before the meeting ends. If anyone has any other questions, please leave them in the chat box. Yes, doctor. So in the management, definitely we have to offer the painkillers. She missed on that, but yes, painkillers has to be the first thing, because if you tell them about exercise and she's hardly able to move because of the pain, then that will deduct your marks. She will not be able to, follow any of your instructions. So yes, in the management, the first thing that you have to do is provide the painkiller. As an FY2, you do the first thing that you have to do, and then referrals to other places, that is something the next. But as an FY2, you do what you are eligible at least to do, and that is giving the painkillers after you've ruled out the contraindications or allergies. So the options to lose weight in this patient, as one of the doctors have asked. First of all, you need to manage her pain. After the pain management, you need to give her the options like diet and exercise, and side by side, she she can be given the medications as well, like Orlistat. But the first priority that you tell her, or the first thing that you tell the patient, is about the lifestyle and about the diet. Tell her these are the main two things. If these won't help, you might put you on medications as well. Or even if we put you on medications, you have to keep the lifestyle side by side, because alone the medication will not help you. However, the medication will be started after you talk to the senior. Okay. Yes, you are right that the referral has already been made. However, the investigations can be done, although the BMI is also given, but the investigations can also be done to figure out if the patient has something else, like high cholesterol. Because if the patient is obese, there is a chance the patient could have hypertension, the patient could have high blood sugar or high blood cholesterol. These are just the routine investigations that you can verbalize for the patient who's coming to you for the first time. Anyways, these will be done later again if the patient is referred for the surgery. Definitely that will be done again. But because you are not referring the patient, you have to give the patient different options. If in case you verbalize the investigations, there is a chance that the other things might come up as well, like maybe high cholesterol, and we don't want to miss that while counseling. So it is advisable, if the investigations are not given, you can verbalize just the initial investigations. Thank you so much. So I guess those are the only questions left in the chat box. Okay. If you have any questions later on, doctors, you can always leave them in the WhatsApp groups. We will be more than happy answering those. And I think we will be ending the session here. Dr. Adnan, would you like to add something in the end?
No, I think you have uh, pretty much explained everything. So I would like to just again thank you, the participants who performed the mock, and rest of the participants who were there. So I would like to thank you again for your precious time.
All right. Thank you all for participating and for joining us, for taking the mocks, and for coming up. Thank you so much. Have a good day. Bye-bye.